Have you ever experienced extreme body pain, nausea, tiredness, or other physical symptoms but without any medical reasons? Well, we're here to answer a few questions relating to this. Hello everyone, I'm Richa, interning under Dr. Shiva Singh at her mental health studio called Talkspace. This month, observing mental health, we are trying to raise awareness around the same. This year's Mental Health Day theme is making mental health and well-being for all a global priority. Today, we are in conversation with a general physician who will help us understand the mind-body connection and answer the question about physical health in relation to mental health. We have with us today Dr. Milind Gurjar, MD Medicine and PhD in cell biology and anatomy. He has over 27 years of experience in the medical field. He is one of the leading internal medicine specialists in Powai, Mumbai. We are extremely delighted and grateful to have you here, sir. Thank you so much for being with us here, Doctor. So we just have a few questions to understand how we can relate psychology and general practice. So just help us with your views here, okay?
Sure.
With your experience. So first thing that I would like to ask is that do you believe that sometimes people come with complaints which have a psychological stem, but they show somatic symptoms?
I think it happens. It happens. It has happened before also, and it keeps happening. A lot of times, people have something on their mind, and it just expresses more as physical symptoms. They don't understand the difference, so they show up as physical symptoms, like sometimes headaches, some non-specific body aches, chest pain, palpitations. And because everybody is afraid of medical problems, they will show up as medical problems.
Yeah.
And a lot of times, there is underlying something else going on, which needs to be just unearthed, uncovered.
How do you go about with that?
Anybody who comes, see, I'm a medicine person, so anybody who comes to me, first it has to be taken and looked at from a medical point of view.
Absolutely.
You have to talk with them, try to get a sense. Basically, it starts with the history taking. A lot of times, by the end of it, you sort of get an idea of where things are going. But at the same time, you have to make them feel comfortable that you're not ignoring their symptoms as such. You're going to have to get some level of testing done if you absolutely feel it.
Right.
And once the testing starts to come back negative, they are more reassured that, oh, there is nothing physically actually wrong with me. And then you can start diving, telling them that probably they need to start exploring other options. Basically, there may be something else which is going on. And a lot of times, their physical, the history itself, reveals that there's something going on at home or at workplace or something else which has happened in the past.
Right.
That has started to have sort of resurfaced.
Right. But we just make sure that there's absolutely no medical treatment.
Exactly, because you can't just tell people everything is in your mind.
Right.
That is always a trouble cross spot for all medicine people.
Yeah.
If you should not get too ahead of yourself. Make sure there's really nothing wrong.
Yeah.
Then once you are comfortable that physically things look okay, then you start moving them to the right.
Absolutely, I think it just makes sense to make a more informed decision on
Sure.
this. Right. So diving a little more deeper into this, so to be more specific, have you seen patients with coming in with pains and shifting aches all over the body with absolutely no medical reason for it?
It does. See, one of the things is people have to understand pain has a huge emotional component. And people do show up with a lot of aches and pains. They may have started out with some really true pain, but a lot of times there's a huge emotional component that is sort of reinforcing that pain over and over again. And there will be some other experience that they have gone through or something else which is going on which happens. So after you treat the initial pain and when the pain is in disproportionate to what, physical injury or something they came in,
Right.
you start to realize that there is something else going on. And one of the things I think in medicine we have also found out a lot of anti-anxiety and antidepressants actually work very well for chronic pain.
Oh, really?
Yeah.
Right. So I think that was my next question, that how do you deal with it? I think part of it you've already answered.
Yeah. So one of the things is, you see, India people don't want to go on to medications. So once you have dealt with the basic level of pain, aches, things like that, you have made sure nothing terrible is going on, and they still keep coming back saying the same thing, then you start telling them probably you need to look at it from a different angle.
Right.
And if some of the patients are they want, no, give me a medical and I'll be fine.
Yeah.
They can be treated with some anti-anxiety and some medication. But a lot of them who are like, willing to go the step forward, then I tell them, you need a counselor and see where things are. At least, a lot of times there will be something else going on, which that can be, sort of, they may need a different way of dealing with it.
Correct. So, like you said, a lot of people would want to just get a quick solution, probably just take pills and all of it. But do you see a willingness increase? Like, how has the experience been over the timeline?
There is definitely people want relief. Now the issue comes up is as long as they are willing to go and talk, then I think that's the best thing. At least it is a start. At least they are willing to. First step is acceptance. That there is really something else going on.
Right.
So if they accept it, then it's much more easier. It's not, I should say, half done, but at least the first major step is done.
Right.
So once they accept there is really something else going on which I need to deal with, or I need to really learn to deal with, then things become easy.
Right. Just extending on the what you said right now, do you think there has been this increase in health anxiety post-COVID, and there have been people coming to you with obviously somatic issues, but also more health anxiety per se? So, what is your experience?
I think COVID has changed their whole dynamic. Number one, I think people were stuck at home. Plus the media, every day people saw a lot of negative news. On top of it, I think most people in the second wave almost, if you go around and ask, either them directly or indirectly have known somebody who has lost a loved one.
Right.
So that has ended up causing a lot more anxiety. And plus the media kept giving new information how people succumb to all these diseases. So anytime after that they developed even the smallest of the symptom, they were very quickly running to the doctors. Yeah. And I think a lot of time this was anxiety and needed a lot of reassurance.
Right.
And on top of it, because of staying work from home, the other pressures are less help, staying alone at home. So friction, the more time people spend at home, I think friction has increased. So that has also relationship pressures, other job pressure, everything has added on. So has anxiety gone up? Yes, it's really high.
Right.
It will take probably last 6 months it has come down a little bit, but still people have old images in their head. And I think that is still driving a lot of people to the physicians.
Right. How do you cope up with all of that?
See, first thing is again the same. Medicine has basically you have to go through the systematic same steps. You have to make sure there is nothing else going on.
Yeah.
Make sure they are otherwise fine. And then at the end of it, you basically try to reassure them as much as at your level. If they develop a good confidence with you, they listen to you.
Right.
But if they start realizing that they need a lot more help than what you can give, then obviously they should be talking a lot more and go into the depth of it, what exactly and how to, most importantly, how to deal with it.
Right. I think COVID has taught us a lot of, how to deal with interpersonal relationships, how to deal with self, how to be alone, how to deal with.
I don't know if it has taught, but we have got exposed to it. Now we have to really learn to deal with it.
Yeah, baby steps.
Baby steps, yes.
Okay. Another very specific question that I wanted to ask was that have you seen people coming in with a panic attack but actually calling it a heart attack?
Oh, that has been there in the past also.
Right.
People came in, but that was more used to be seen in women when they went through menopause.
Okay.
So now they even came in with taking anti-angina medications and everything else.
Oh, okay.
But even now people still, they don't feel heart attack, but they feel there's something wrong. They have got some cardiac problem going on. They have palpitations, or they have chest pain, or something like that, and they have got, and again, Dr. Google also helps them a lot in increasing their anxiety. So that is another huge problem. They read a lot of things and they come in with the presumption that I think something's terribly wrong with me.
Yeah.
And obviously it's happening. And with all the negative news every time, the other thing that is happening is post-COVID also, I don't know, for some reason last 2 years, a lot of negative news about young men dying has shown up on the media.
Right.
So that itself has added to this anxiety.
Absolutely. What do you think would be the reason for that?
The reason there's a lot of reasons, but eventually I think one of the main, this is my personal opinion, is a lot of support system has gone from the society.
Right.
Previously people were having a much more bigger joint family, things were distributed, responsibilities were divided. Now with nuclear families, both working or whatever it is, job pressures, and then the COVID pandemic basically hit everybody. So it was all already a little bit delicate, and now that has just gone through the roof.
Right. So we've talked about how people show how they show symptoms. But can I ask, how do they actually fall ill because of poor mental health? Like, do they actually fall physically ill?
They can, and they probably are also, because one of the things is that when people are under a lot of pressure, their habits go bad.
Right.
One of the things, again, I don't know about other people, but some of the things I have read is whenever you are under a lot of mental pressure, people start to eat comfort foods. Comfort foods always come with salt, sugar, and fat.
Right.
It is a very well-known studies done in Western world again and again. If people see a lot of bad news, they will eat ice creams and junk food and all of things.
Right.
And I think once you eat bad stuff, you already expose yourself to lowering your immunity. On top of it, people are not exercising.
Yeah. That, and also I think the idea of going into the entire substance abuse has always been there.
Substance abuse is there. Alcohol has gone up. It's much more readily available, and people are more accepting.
Right.
Other drugs, I don't know how easy. Probably the younger generation is much more exposed, and that is a big pandemic for them. But I think even the middle age, or even most people across the board, when people are under a lot of pressure, the first thing they compromise is on food.
Right.
They will eat anything that comes their way.
Okay.
And because of the pandemic, nobody was getting out. The pressures were there, psychological pressures were there. People were not exercising.
And I think what's the sad part is that there's so much information about nutrition right there on literally every source of information, be it media, newspapers, but we still do it.
The reason is people love to read.
Yeah.
But following any kind of thing is much more difficult.
Yeah.
When every day if you open a newspaper and there's an ad for big paper ad for pizza, there are 10 ads for cake, something else. Asking somebody to every day, eat green leafy vegetable is very difficult. And more importantly, people have to decide. Right now, young people are there, they feel they are right now invincible.
Oh yeah.
Once the first time they get the shock of their life, they suddenly wake up, oh, something has happened to me.
Right.
And when they see a bad something in the news, then the flow of people shows up to the clinic a lot. Because if you see a young actor die suddenly at 42 from a heart attack in a gym, suddenly all the young men are showing up with their wives, I'm having, I think, I'm the next in line for the heart attack.
Right.
So all this exposure also is creating a lot of problems. COVID has basically prevented everybody from walking.
Oh, right. I mean, two sides to every coin, right? Yeah. Just to put it in more statistical form, what age group or gender group do you usually see coming in for psychological issues, but actually calling it, somatic issues?
Right now, I think most that I see is between 30 to 50.
Okay.
Younger ones just feel they're not going to get sick.
Oh, okay.
Below 30, 25, 28-year-olds, they feel they're going to be absolutely fine for everything.
Right.
When they go through a tough thing, then they suddenly wake up.
Right.
But 30 to 50 or 30 to 55, they all show up.
Right.
Either directly or from pressure from the family.
Correct.
They are all showing up a lot more. And they are the ones who are under a lot more pressure, because most of these are the ones who have families, have young children. So the pressure of financial pressure, other pressures, job loss pressures, and plus the fear of death and what will happen to the family is also huge. So they will have a lot more symptoms. Even the slightest thing that happens, they show up much more.
Right. And do they actually have physical issues?
Some of them have, because COVID has caused obesity epidemic. Weight has gone up, other things have gone up. And because of this, other thing that happened is people have started doing a lot more testing. So we are picking up a lot more things, which anyway the statistics they were saying is there, but was not being unearthed.
Right.
So one of the statistics, 1 in 5 Indians is diabetic over the age of certain 30, 35. But now everybody is testing and they are finding out they are diabetic. So physical symptoms, physical things are there, but I think the main other thing is they need to all take care of themselves and nobody else. It starts with first is make sure that they mentally desire I want to do something.
Right.
On paper and in their mind, in the clinic, they're like, yeah, tomorrow I will start doing everything. But 6 months down the line, they're at the same.
Yeah, like we say, the basic definition of health is not just physical. It's going to be your mind and your society.
Everything. The mind-body connection was there before also, which was known but only not proven.
Yeah.
It's just going to, at some point, it will get through.
Yeah, it's just in more light now.
Exactly.
How is it? What you've told me across age, but how does it differ across genders? Do you see any?
Right now, I think I think it is more with social situation.
Right.
Two things that happen is people focus more on men's health.
Okay.
Because most places, men are still the major bread earners.
Right.
A lot of times, women are more dependent. So technically, and other thing that happens is women are anyway going to outlive men most times.
Yeah.
So what ends up happening is all the focus is on the men's health. Anything happening to the guy, his wife, everybody will drag him. His parents will drag him. Everything else. Women's health is again physical. I think diseases are much less, but for them other pressures have increased. So I think they are showing it more with psychosomatic symptoms compared to other things because staying at home, doing all the work, doing the job, kids school, online. So all this thing, and plus if they are a joint family living in a small house with in-laws, that pressure has added up. So for women, the other things have changed. So I think that men come in for physical symptoms not because of anything else, because everybody is afraid they are going to all have a heart attack or some major illness. Women are showing up because they are just under a lot of pressure.
Right.
So their disease spectrum is different.
And what will be your recommendations to all people out there who face that?
The recommendation is still going to be the same. Start with first taking care of yourself.
Right.
And taking care of yourself means not only at the physical level, but also at your mental level is basically you have to grade your expectations. Everybody cannot be an Ambani or an Adani.
Yeah.
And people unfortunately are running very fast for a bigger car, bigger house, bigger everything.
Right.
Without realizing that, by the time you will one day stop and look around, the whole life is gone.
Right.
And I think that is the main. People have to, you scale down either their expectations or be realistic, I would say, more in their expectations. Right. That will give them more peace of mind. How they do it, they know. Everybody is different, everybody's ideas are different, but somewhere along the way they need to find to be happier.
Right.
And right now everybody is looking happiness in objective things, car, house, or you name it, right? Or vacation, all these things, which I think may not be the case.
Right. But I think people like you and Dr. Shiva there were like the big soldiers in the medical history who help people.
We don't know. We at individual level, one at a time, you try to do things for them. But again, you can show the guiding, you can show the path.
Right.
It's like the old saying, you can lead a horse to the water.
Absolutely.
The horse has to drink. So you can tell them you should do this, you can do that. And I tell all my patients, your wife cannot be in your pocket or the doctor cannot walk around in your pocket.
Right.
Until you decide mentally, nothing will change.
Absolutely. Okay, thank you so much. I think, thank you. This was such an enlightening conversation. Thank you so much for sharing us.
Thanks a lot for having me here.
Thank you.